Well, that's a good segue kind of into the next question. So we just kind of wanted you guys to talk about how many procedures, how long you've been doing it, and if you have any patient stories or successes you'd like to share.
I was here in 2008 when St. Bernard's purchased the first robotic system. This is not it. It was an older version, and it's kind of like getting a new car. They always come out with a newer and better version, more technology, more bells and whistles. And as Jamie pointed out earlier, this is the most current that's available anywhere. And St. Bernard's was one of the first that had it in the country, and I'm pretty sure the first in the state that had this new system. So we've always had good technology at St. Bernard's. And I was here in 2008 when the first one was purchased. They're over $1 million. It's a big investment. And I started using it immediately. I think I was the second surgeon. Dr. Emerson beat me to it. He did the first gynecologic case. We don't have a gynecologic specialist up here, but I've been using it ever since. I'm a huge fan of it. I just think it has revolutionized the way that I do surgeries, as I said, on prostates mainly for prostate cancer, and then kidneys also for kidney cancer. So I have probably averaged at least 2 cases a month ever since then. Lately, I've started doing more procedures, different types, and so my numbers are going up even higher now. So that's when and how many. Do I have any success stories? I have a whole lot of them.
I think you could talk about prostate and the difference.
But I have one particular patient who I removed his prostate robotically because he had prostate cancer. And then it was a couple years later that he was unfortunately found to have kidney cancer. And so, naturally, I told him that we could take care of that robotically as well. So he ended up having a kidney surgery. And I'm very proud to say that I believe he's cancer-free of 2 different types of cancer. And he really didn't slow down much after either surgery. He still does his job. So that's something I'm proud of. I'm sure there's lots of good stories, though. And just to say, add something to Dr. Wiggins, anybody can watch these YouTube videos. If you want to see what a real surgery looks like in action, you can go on YouTube and search for it, and you can see the same stuff that we see when we're looking through that console.
So I've done more than 100 cases. I think it's probably close to 125 now on the robot. I've been here for 3 years, so finished training about 3 years ago. What was the other question? Patient success stories, yeah. There's a lot of those. One general example I would say is, acid reflux is pretty common, so people with severe acid reflux. A lot of times if the procedure is going to be simple, we can do it laparoscopic as well and as quick as robotic. So some people, this is going to recur in, I'd say, about 10% in 10 years. If you have that surgery to prevent reflux, it's going to come back. Well, redo surgery is much more difficult. There's a lot of scarring, and it's more dangerous. So almost all those people are always getting a huge incision, staying in the hospital a week. You can get hernias from that, a lot of potential complications from that. You cannot do it laparoscopic. It's too dangerous unless you want to spend 8 hours, and even then. So you can do it robotically. So we both have had a few people where they needed this surgery again, a redo surgery several years later, and we did it robotically. They go home the next day. And I think that's wouldn't have been possible before. And before he talks, he's being pretty humble about the lung surgery. The lung surgery is completely revolutionized. I mean, if you have a huge incision on your chest and you crack your rib, cut out part of your rib, you're going to be in the hospital at least a week, multiple potential complications. And if you leave in 2 days with much less pain, it is a humongous difference. Very big difference for the patients. So anyway, go ahead.
We've had a patient in common, one time, a fellow that had a rectal cancer and also had a lung cancer. And so the question is, what do you do first? if you had to have a standard thoracotomy, you're going to have to wait 8 weeks before he can even think about starting chemo, radiation, and then another 6 weeks afterwards to have a resection of that. So, and then if you did it the other way around, the lung cancer is liable to grow. If you're going to have to wait another 3 months to get over all this other radiation plus, a large abdominal surgery. And so it really fit in very well for this one individual, and I've had another since, to do a robotic resection, a lobectomy. He went home in 3 days. He was able to start within 2 weeks, start his chemo radiation, and then later on have his resection of his colon cancer. So it helps with just the logistical problems of if people who have 2 different, cancers. What do you do? But I think that Josh's point, why do you do laparoscopic? Why do you do robotic? If you think about it, laparoscopic surgery, we're using a camera and we're using small incision. It's minimally invasive, but you're operating with sticks, and so there are limitations to that. Whereas with robotic surgery, you have wristed instruments, better visualization, and you can do more. You're more adept at what you're doing in the body cavity. You can show you a little bit about how it works on this simulator. You can tie, you can sew a lot easier than with a stick. So it makes a difference. And what we've done, like Josh was saying, for hiatal hernia surgery, for reflux surgery, I still do laparoscopic on standard ones, but if it was something that I was going to do open, like a redo surgery or a large intrathoracic hernia that has a shortened esophagus, you have to do a lot of dissection, which I would have done open, or just a really large patient, those I do robotic now, which I would have done open before.